Good afternoon, everybody. One great thing about wearing a mask is that you can express yourself. You all probably know I'm a Carolina Hurricanes fan. Go Canes. Good afternoon. I want to thank you for joining today's update on COVID-19 in North Carolina. As of today, we have over 65,500 lab-confirmed cases, 1,843 new cases reported today, 901 people in the hospital, and 1,373 people who have died. Today is our highest day of confirmed cases. If you're struggling after the death of a loved one or maybe fighting COVID yourself, we send you prayers for healing. North Carolina is continuing its pause in the Safer at Home Phase 2. And of course, we've added the requirements for face coverings when in public. Since that took effect Friday, we're encouraged to see more people wearing their face coverings when they're out and about. As we go into the holiday weekend, we must keep our guard up. This virus is just as contagious and deadly as any other on a holiday as it is any other day. And I know we want to gather with family and friends, but we have to remember that a large gathering, especially without masks and social distancing, is one of the most likely places for COVID-19 to spread. The holiday may be different from years past, but we can still celebrate our great country's independence while keeping it safe. Today, we'd also like to give you an update on the discussions about reopening public schools for the 2020-21 school year. In early June, we released the Strong Schools NC Public Health Toolkit that laid out essential health practices for schools to reopen safely. Schools were asked to prepare 3 plans. The first plan is in-person learning with key health and safety rules. The second plan is the same as the first plan, but with fewer children actually in the classroom at a time. And the third plan is remote learning, all remote learning for students. District and school administrators are still working on ways to implement those plans, and we're asking them to keep using the time to work with teachers and staff and parents and public health officials to make sure that our schools are opening in the safest possible way. Let me be clear. We want our schools open for in-person instruction in August. The classroom is the best place for children to learn. Recent reports recommend it, and I know many parents and children agree with this. School is where children learn academics, but it's also how they build their social skills, get reliable meals, stay physically fit, and really become tomorrow's leaders. We're not issuing a statewide directive today on how schools should open in the fall, but we will soon. We want to get our students back in the classroom, and we want to make sure that we get this right. My number one opening priority is classroom doors. So we encourage our public schools to continue that planning with a special focus on how teachers, staff, and students can best be protected, especially those who are high risk. Work to prepare our schools is already underway. For example, this week our emergency management and public health staff began delivering a 2-month supply of medical-grade protective wear to schools across our state. These face shields, gowns, and other gear will go to school nurses and staff who have to provide health care to children while they're at school. We've also given school districts access to statewide contracts so that they can more easily purchase for their staff and students other health and hygiene supplies like cloth face coverings and hand sanitizers. We're also encouraging private companies to give too. We need to do more, and we're committed to work with schools, teachers, parents, the Department of Public Instruction, and the State Board of Education to make sure that our schools are safe. Now, when we had to close school for in-person instruction in March, our teachers and school support staff, like bus drivers and cafeteria workers, geared up for remote learning. And I'm thankful for their work to keep lessons, the meals, and the support for their students going. As you all know, my mom was a teacher, and I know how educators make many sacrifices even during normal times, and now we are in extraordinary times. As school restarts in August, it's vital that we look out for the well-being of our teachers and other school workers, as well as our students. A few schools are scheduled to start in July, and we ask that those schools conduct remote learning until the decision is made for in-person learning. And that will be made soon enough for schools to go back in August. Our goal remains getting children back in the classroom for in-person instruction that's safe for students and their teachers. To meet that goal, we want to avoid the increased virus spread that we're seeing across the country. We need everyone to do what works. The 3 W's. Wear a face covering over your mouth and nose. Wash your hands. Wait 6 feet apart. Especially the face covering part, which we learn every day to be more and more important to this process. Sticking to those safety rules now will help schools get back open safely. It'll help stabilize our numbers and our trends, keep our hospitals from being overwhelmed. And at the end of the day, it'll help save lives. We have the power, and we can do this together. Today I'm joined by the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and Emergency Management Director, Mike Sprayberry. Monica McGee and Brian Tipton are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll first hear from Secretary Cohen.
Thank you, Governor. COVID-19 is formidable. It has caused each of us to weigh the benefits and risks of actions like never before. Seemingly small actions, like wearing a face covering, waiting 6 feet apart, and washing our hands often, now have an outsized impact not only on our own lives, but on the lives of all North Carolinians, including our children. We need to do everything within our collective power so that our children can return to in-person instruction. I can't say it better than the American Academy of Pediatrics did this week. Schools are fundamental to child development and well-being and provide our children with academic instruction, social and emotional skills, safety, reliable nutrition, physical, speech, and mental health therapy, and opportunities for physical activity, amongst other benefits. While missing school is harmful to our kids, the emerging scientific evidence suggests that going to school is less of a risk as we think about the potential spread of COVID-19. At this time, international research shows that schools have not played a significant role in the spreading of COVID-19. Children, particularly younger children, are less likely than adults to be infected with COVID-19. And for children who do become infected with COVID-19, they seem to be less likely to transmit it to others. We will continue to have to evaluate the scientific research carefully on this, but the current science is encouraging. This is critical because decisions to open schools cannot just be about the children, but also must consider the health and well-being of our educators. We can and we must lower the risk of returning to in-person school even further. And we can do that with scientifically proven protective measures in the Strong Schools NC guidance, which were reinforced this week by the American Academy of Pediatrics. They also called for face coverings for teachers and students, practicing social distancing and grouping students, and of course, good hand hygiene and cleaning protocols. There's still more work to do to make sure that those requirements for school reopening become a reality for our schools. We need to be sure that teachers, school personnel, and students have the face coverings they need and the resources needed to implement the comprehensive public health guidance we released last month. My team will also continue to support the Department of Public Instruction and the State Board of Education in their planning efforts so that districts have concrete plans to protect teachers and students who are at high risk from serious illness from COVID-19. Our teachers are smart, dedicated, and anxious to get back to the classroom with their students. We have to support them so they can do just that. My dad was a middle school teacher and a guidance counselor, and that's what I would want for him. We know implementation will not be easy, but we are confident that school leaders and teachers will rise to the challenge as they always have. All of us also need to do the work together right now through the month of July to slow the spread of this virus. We need to take those seemingly small actions I mentioned, started with wearing a face covering whenever you're in public. With today being our highest day of cases yet, I cannot stress how important this is. Wear a face covering because you want to protect your loved ones and your neighbors. Wear a face covering because you want to reignite the economy and support businesses. Wear a face covering so our children can be back at school where they can grow, learn, and thrive. Thank you.
We'll now have our Emergency Management Director, Mike Sprayberry. Mike?
Thank you, Governor. Thank you for your leadership. Today is day 114 of the State Emergency Operations Center's COVID-19 response. We want to offer a special thanks to all of our National Guard soldiers and airmen helping the State Emergency Response Team operation. They are working tremendously hard. Today, the State Emergency Response Team, like the Governor said, is completing shipments of personal protective equipment to school systems and charter schools across the state. These shipments started Monday. Each school district or charter school is receiving a starter pack of personal protective equipment based on the school or school system size that includes a 2-month supply of thermometers, surgical masks, face shields, and gowns. This equipment is intended for school nurses and designated staff who provide health care to students. In total, the shipments include more than 16,500 thermometers, 7,200 face shields, 81,000 gowns, and more than 347,000 surgical masks. Shipments to more than 200 charter schools and smaller school districts will be sent via package delivery services. Larger public school districts will have their supplies trucked directly to the school district warehouses by North Carolina National Guard teams or by a contract trucking firm. School leaders have already been receiving guidance from the Department of Public Instruction on what supplies they will receive, what supplies they should plan to purchase for their school or district, and to understand how and when to use personal protective equipment. They also have been given information on how to purchase future supplies using state contracts. The State Emergency Response Team is still aggressively delivering PPE to hospitals, long-term care facilities, first responders, and others on a daily basis. Just yesterday, we delivered PPE to 60 counties and one healthcare preparedness coalition made up of many hospitals. We also received 91 requests for PPE. So far, the state has committed more than $280 million to PPE purchases for the COVID-19 pandemic. The CERT team also continues to identify both non-congregate and congregate sheltering locations and refine sheltering plans for hurricane season 2020. A non-congregate shelter can be established in places like hotels, universities, and schools to ensure evacuees can remain socially distant. During the pandemic, it is the recommended type of sheltering. We're also planning on establishing locations for congregate shelters like gyms if they're necessary. But during this year of the C-19 pandemic, we want our residents in hurricane and flood-prone areas to make an evacuation plan to stay with family or friends at a safe place inland or at a hotel. Again, staying at a shelter will not be a good option during the COVID-19 pandemic. Staying with family, friends, or at a hotel will reduce the chances of you being exposed to or transmitting the COVID-19 virus. Shelters will be available for those with no other options, but they should be a refuge of last resort. And please don't forget, when preparing your family emergency kit this season, go to readync.org, that's readync.org, to ensure you have all the items you need to help you stay healthy, like face coverings, hand sanitizer, and cleaning wipes. Lastly, you heard the governor say it, you heard Secretary Cohen say it. It's backed up by science. Remember to observe the 3 W's. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. This is how we slow the spread of the virus. No fancy tools. By working collectively together, we have the power. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike. We'll now take questions from the media. And if you could give us the name of your organization and your name, please. We'd appreciate it. Thanks.
Our first question is from Brian Anderson with the Associated Press.
Hi, Governor. Brian Anderson here with the Associated Press. Thank you all for taking the time here. I appreciate it. Governor, you said earlier that the statewide directive today is not going to be issued for reopening, but will be soon. What's the timetable for that? Are we talking later this week, next week? I know a lot of parents are eagerly awaiting some greater sense of direction. Secondly, there hasn't really been much discussion of higher education and colleges. With some schools planning on opening August 10th, do you foresee any guidance going towards higher education from your administration beyond some of the little tidbits UNC systems put out thus far? Thank you.
Thank you. We are well aware that parents, teachers, students are so anxious to know about school in the fall, and that is from K through 12 all the way through our community colleges and universities. We're continuing to get new science and new reports, and a lot of work has been going on over the last few months among educators and public health officials. This is my number one priority, is making sure we reopen those school doors and get children physically in our schools. I want to make sure we get that right. So I would say within the next couple of weeks, because we know that some schools will open or start as soon as August the 3rd, and they'll need time. They're supposed to have done all 3 of these plans and getting ready for them, but then they'll know what the requirements are from the state level. So within the next couple of weeks. We're also in close contact with our community colleges and universities, and also have been providing information to them. And I think Dr. Cohen has had some recent conversations with President Roper, and I might let her make a comment or two about that. Dr. Cohen?
Sure. Hi, Brian. Thanks for the question. I think all of these decisions about how do we balance the reopening of schools as well as higher ed and all of the other decisions we need to make all come back to fundamentally what work can we do together to slow the spread of this virus. I think we've been doing good work here in North Carolina. While we see today is our highest day of new cases, we continue to see our hospitalizations be up a bit, but they're not. We still have hospital capacity. We're not on fire like we're seeing in some other states, which is good. But we have hard work to do here in July to keep that spread of the virus level low. I know Dr. Roper and the rest of the UNC system also wants to go back to in-person education and bring their students back to campus. I think it's on all of us across the state of North Carolina to keep that virus level low so that we can do that hard work of getting our students back. We know what incredible benefits to K-12 education are. I know that they want to do the same in higher ed, but we're all going to have to work together on this, and we're going to make sure that we are going to be constantly communicating. I've really appreciated Dr. Roper working with us to convene other higher ed leaders. I know they are thinking about those balances between public health, protecting their students and their faculty as they make these hard decisions. So we're going to keep working on that together as we move through the month of July. Thanks.
Thank you. Next question.
Our next question is from Kenny Beck with WXII.
Governor Kenny Beck, WXII. Thanks for taking my question. You've mentioned many times that your goal, top priority, is kids back in the classroom in August. Does a scenario exist where that would just not be possible if the numbers continue to trend in a negative direction? And for Dr. Cohen, as we see the state set yet another record today for most new cases, can you give us any more detail about this recent spike? Is there a commonality? Is there a part of the state where it's happening? Is there a way in which it's spreading? Can you give us a little more detail other than just 1,800 plus cases?
Of course, it's possible that we would not have in-person school if the numbers were bad. We do, however, know a lot more than we knew in March when we closed the school. We know a lot more about this virus, how to live with it, how to deal with it. So what we want to happen is for our numbers to stabilize and make sure that the number one reopening priority is our public schools. And that's going to collectively take all of us working together, wearing the face covering, waiting 6 feet apart, washing. Those things don't cost anything to the economy, and in fact they help our economy because they'll help things get started faster and get things that are already started moving faster in the right direction. So we are still aiming for in-person instruction, and we hope to do that. I'll let Dr. Cohen comment on the numbers.
Thanks for the question. I'm going to do a full rundown of our numbers tomorrow, and we'll go into more detail and not just our case numbers, because remember, we have to understand those case counts in context of the other trends that we also continue to watch. So we'll do that tomorrow. But in terms of what do we think is driving the case numbers, we've seen in the last number of weeks that it is our younger adults that are driving the majority of our numbers between 18 and 49. We also know that we're seeing an outsized impact on our historically marginalized communities, our Latinx community. We've talked about that at press conferences in the past, and that is really important. What you can see from the data we put up, which goes down to the zip code level, is that the quantity of the numbers are coming from some of our more populous or urban areas, from the Triangle, from the Triad, from the Charlotte area. That's where most of the people live. It's where most of the numbers are coming from. But we're also seeing pockets, if you look at the numbers per capita, we are seeing pockets of higher rates of infection, particularly in some of our agriculturally dominated counties in our southeast part of our state. We want to make sure that we're working with our agriculture partners to make sure that folks are paying attention to the preventive measures of wearing face coverings, waiting 6 feet apart, washing their hands. Those are incredibly important. We're also seeing a number of other kinds of industries, again, that we've been talking about for a while: meat packing, manufacturing, construction, other jobs that are critical infrastructure jobs, but that bring people close together, that make it hard for them to social distance. It reinforces why that mandate on and requirement to wear face coverings is so important. We all have the power to slow the spread of this virus, no matter where you are. But remember, those folks who work at construction sites or work in agriculture then can go shop at grocery stores with others who don't work in those industries, which is, again, why we all have to work collectively together to make sure we're not seeing spread of the virus more around our state. And we have the power to do that, and we need to work hard on it over the course of the next couple of weeks and months. Thanks.
So you have been listening in to the Coronavirus Task Force here in North Carolina. The governor, DHHS Secretary Dr. Mandy Cohen, addressing school in the fall, but not offering a whole lot in the way of specifics. You heard the governor and other state leaders say it is absolutely their goal, their wish, to send children, K through 12 public school children, back to school in August. You did hear the governor say, of course, it is possible that if the numbers continue to trend in the wrong direction, that they will have to seek another
start date to late August or even after Labor Day to allow a little more time to prepare for this.
One of the things about this pandemic and the research that is continuous with this virus is that we're learning more every day. So I think clearly guidelines could change as health experts know more. The thing about that pediatric society report is that it shows how important it is to have our children in the classroom learning, and all of the things that they miss when they're not there, not just academic lessons, but the health, nutrition, well-being, socialization, all of those things that are important to a child growing up. They're emphasizing that we know there's always a risk when there's a virus, but it's important for you to work hard to make sure we get our children back in school. And that was already our thought process anyway. I'll tell you, other governors and people across the country are dealing with the same issue. We're talking with them as well. But I'll let Dr. Cohen address specifically how that report might affect our guidelines.
Thanks, Governor. As I review those guidelines, I think they're incredibly consistent with the kinds of requirements and additional recommendations that we put in the Strong NC Schools guidance. And so we encourage all of the school districts across the state to continue to work with us, work on their planning. I think importantly, what we may need to make sure to do is to have that planning be really robust, because things could change. Not only will the science and evidence potentially change, but the virus could change here in North Carolina. So we want to make sure that we have different plans so that that children would have the opportunity to learn. Again, our goal is to get back to in-person instruction. That is possible. I think the emerging evidence is showing that children not only get COVID-19 less often, but if they do get it, they transmit it less. Those are encouraging signs. Means that there is less risk in our school, but then we need to go further and do these activities that are codified in our guidance and are required in our guidance to say we have to protect our teachers and our students as we think about in-person instruction. It is possible. It is hard work. We want to work with folks to get there. It starts with PPE. It starts with plans for high-risk teachers and students, and so we'll continue to work on that. And again, I think all incredibly consistent with where the Academy of Pediatrics and their recommendations continues to be. Thanks.
Thank you. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. Thanks for taking my questions. You talked about reopening schools as being a priority, and of course you're aware the General Assembly has sent you multiple reopening bills and some related to having Council of State concurrence on orders. I wanted to ask why if it's not required, why you've asked for concurrence from other Council of State members previously, and then also about the mask mandate enforcement. Has any of that been has the state been involved in any of that enforcement at government buildings and agencies, or is everything complaint driven outside of businesses? Thank you.
Well, thank you for that question. We know that, to take your last question first, we want to make sure that people abide by this face mask law, and we're seeing a lot of compliance across the state. We've talked to local law enforcement about it. Many of them are talking to local businesses and people that they see on the street, so that's an important thing. I also think that the executive branch and the governor needs to have the flexibility to be able to make decisions about the public health and safety of the people of this state. There are some decisions that require Council of State approval. There's some that do not, and we have followed the law. What I think these laws would do would be to put more bureaucracy in this, and we see right now in Arizona and Texas where governors are having to make quick decisions about going backward in their progression through their phases in order to be able to protect the health and safety of the people in Arizona and Texas. And that's something that public health officials and the governor should be able to do without the bureaucracy that would be laid out in these bills. Next question.
Our next question is from Ashley Talley with WRAL.
Hi, Governor. I wanted to ask about your reaction to other states, largely with Republican governors, who have been opened, their numbers went way up, and now they're closing again. Does that give you pause about future plans to reopen? And also, I wanted to ask if you plan to sign or veto Senate Bill 168 about the public information and death investigations. Thank you.
We're keeping an eye on all of our trends and indicators that Dr. Cohen goes over probably on a weekly basis, but that you can always find on our dashboard for us to make decisions about how we progress through our phases. And I ordered a pause in our progression and the mandatory face covering because we were seeing these concerning trends, both from the early process of people presenting to the emergency room with COVID-like symptoms to a stubbornly high percentage of positives. So we made this pause in order for us to prevent having to go backward like these other states have done. And I hope that the people of North Carolina will rally together like we did when this virus first hit. We've never had a real surge in North Carolina. It's because people of North Carolina have pulled together to work to try to slow the spread of this virus. So we're asking the people to work really hard because we know we've got to do an important thing in a couple of weeks, and that's get our children back to school. So let's please work hard. This Senate Bill 168, I know that there is a concerning provision in there about public records. I'm concerned about it. The legislation also does a number of other things that are positive. It helps to bring down federal money for substance use disorder and mental health, and it helps align some laws. So I think there are going to be conversations that are going to go on with the General Assembly about how we fix this. I think most people don't want to have this provision, and I think we'll figure out a way to make sure that we fix it. Next question, please.
Our next question is from Michael Hyland with CBS 17.
Hi, Governor. I wanted to follow up on the decision not to announce the K-12 school plan today. I don't feel like I have a clear understanding of why that announcement is not happening today. Has something specific happened in the last few weeks, or has something not happened to impact that timeline? Thank you.
We've learned a lot more in the last few weeks with studies that have come about. We're working to get more buy-in from teachers and people who are on the ground to make sure they understand all of the requirements in the plan. I think it's important for us to get buy-in, as much buy-in as we possibly can across the board before we announce decisions. There's going to have to be a lot of local decisions made because school districts are different. But we believe we needed a little more time to make sure we get this plan right, because education, I think, the most important function of state government. I've said that many times, and this decision about reopening schools and how we do it safely and make sure our kids are learning is one of the most important. We want to make sure we're getting it right. Next question.
Follow-up, Michael Hyland, CBS 17.
Thank you. When you refer to getting more buy-in from the teachers, have you heard specific concerns from them that you're trying to address, and can you tell us what those are?
A lot of teachers are concerned about going back to school and making sure that they can do it in a safe way. Most of the ones I talk to are eager to get back to teaching their children. They want to make sure that they are protected and the children are protected. And you know, we're in a new situation here. It's extraordinary. It's already hard enough to be an educator and a student in a public school and a principal. Those jobs are so hard. Now you're going to have to layer on all of the sanitation, the social distancing, the wearing of face coverings, and making sure that we're protecting everybody to the greatest extent possible. And how we do that is important. And so we've been running this by a lot of people, and a lot of superintendents and principals, the members of the State Board of Education led by Chairman Eric Davis, Department of Public Instruction led by Mark Johnson. Everybody's been working on this to get the kind of input we need, and wanted a little more time to make sure we get it right. Thanks. Next question.
Our next question is from Jonah Kaplan with ABC 11.
Hi, Governor. Good afternoon. Jonah Kaplan with ABC 11. I want to follow up. Actually, what kind of feedback are you getting from school districts? Are they the ones that ask for more time? Did they find issues with maybe some of the provisions of Plan B? And also, are you considering a regional approach to the plans? And for Dr. Cohen, if you don't mind me peeling the onion back a bit, you've mentioned how most new cases are ages 25 to 49. You mentioned again the Latinx community. When this started, though, you were very specific. This person traveled from Seattle. This person came from Italy. This person was at a conference. Is travel a concern right now as we head into the holiday weekend? Is there data to support that air travel is leading to infections? Thank you.
You know, some school districts want us to tell them exactly how to do it. Some school districts want more flexibility on how they do this. I think that we will plan to give schools some flexibility because we know that they are all different. But we made this decision because we just wanted to make sure that everybody had their input and that we knew exactly where we wanted to place this. And I feel confident that we'll come forward with plans that are workable and that schools will be able to get their children back into school and teachers back in the classroom. I'll leave Dr. Cohen for the next one.
Hi, Jonah. Thanks for the question. So right now, I believe that our transmission is driven by exposure that's here locally in North Carolina. It's not driven by travel. We did see that early on, that we were seeing transmission being driven by people who were traveling and then had returned here to North Carolina that seeded the first amount of infection. I think as we moved on, we saw some of the infections being in our long-term care facilities. What we're seeing now is just wider community spread. It's why our numbers are up. We knew as we eased restrictions that we would see more people moving around and more virus moving around, and that's exactly what we are seeing. So we're seeing this exposure really about locally driven transmission. It is workplace exposure. It is exposure at gatherings, and again, that is why we want to make sure that folks who are working in higher risk settings are getting tested. If you've been to a mass gathering, to be tested, but also to avoid those places because that's where we know the virus is spreading. And I think as we look forward to July 4th weekend, we know it's a time where folks want to come together. There are safe ways to watch a fireworks show, doing it outside, being socially distant, doing it from your car, those kinds of options. We really want to make sure that folks are employing those options as they think about planning for this coming weekend. We do not want to see a surge in cases that links back to a lot of large gatherings that might happen on a holiday weekend. Thank you.
Next question, please.
Follow-up, Jonah Kaplan, ABC 11.
Good afternoon again. Dr. Cohen, you've talked about how we have an increase in cases, not a surge in cases. When we look at the state of Florida and the city of Jacksonville in particular, they're now ordering a mask mandate in the city. I'm wondering, with that in mind, are you going to invite back the RNC to North Carolina? Thanks.
Well, thanks for that question. I think that what we have been seeing is still a slow but steady increase in our cases. We were reporting our highest day of new cases today with more than 1,800 cases. And we're almost getting numb to hearing these numbers, but they are big numbers of new cases that we're seeing every day. But it is not the skyrocketing cases that we're seeing in other states, but it is a cautionary tale that we have work to do here to continue to keep that virus level low. And what it has shown me is how quickly things can change. Just remember, a few weeks ago, the Floridas and other southern states were looking stable, and it is so quickly we see that can change, and that's why we have to do the hard work now. We don't want to have to go backwards, and that's what we're seeing in Florida and in Texas and in Arizona. They have to go backwards. We don't want to have to go backwards. We want to make progress. We want to get our kids back to school, and that's why we needed to pause our reopening for now, do this mask requirement, avoid large social gatherings this weekend when you are celebrating July 4th, and we're going to focus on making sure that we are keeping North Carolina and that virus level low here. Thanks.
Next question, please.
Our last question today will be from Matt Bennett with WWAY.
Hi, Governor. Thanks for taking my question. I still don't feel that I have a great understanding about, I know you said that you want more time, but other than that, what specifically has changed for you to cancel your announcement today, and what will need to change in order for you to make that announcement? Thank you.
We continue to get in more evidence regarding the kind of steps that we need to take to make sure that our teachers and our children are safe at school. And we're continuing to get more input from teachers and from parents, and we want to assimilate all of that and make a decision within the next couple of weeks. We had set this period of time to give us plenty of time for schools to get ready. They'll still have plenty of time as we make it in the next couple of weeks. So we look forward to coming forth with our plan for our schools across the state, and we hope to do it in conjunction with the State Board of Education, with the Department of Public Instruction, with Public Health, and we all need to be working on this thing together. Follow up? Nope, no follow up. Okay. Okay, thanks very much. We appreciate it. Have a happy and safe 4th of July for everyone. Please be careful, healthy and safe, and wear your mask, stay 6 feet apart, wash your hands. Thanks.